a number of people, women particularly, that have said either after suffering from COVID, or just kind of in the midst of the pandemic, have suffered hair loss or have experienced that. And so I wondered if you had heard about that, if you've had any patients that have experienced that, or why that might be happening.
Sure, there has certainly been an increase in the number of patients presenting with hair loss since the pandemic has hit. And what we're seeing is it's just abrupt shedding of hairs. And this is a common disease that we do see in dermatology. It's called telogen effluvium, where the resting hairs just sort of go into this abrupt shedding, and the hairs that normally grow also transition into this shedding phase. So it's usually preceded by some sort of physiologic stress to the body or shock.
Mhm.
So typically we see it after women give birth, or there's an illness, death in the family, and then 2 to 3 months later, you start to experience this hair shedding.
I was
Mhm.
reading some of it associated with fever, perhaps. Is that true as well?
It can be. So that's why illness is a common factor. So fever, again, that stress that fever can have on the body kicks those hairs into that hair shed phase.
Okay. And
So,
when you say you're seeing people, or you're seeing an influx of that, is it people that have had COVID, or are they kind of come in perplexed? Like, why is this happening to me?
sure. We don't think it's related to actually having the virus itself, but more the physiological and emotional stress that the pandemic has had on these people. So, on all of us in a way. So, there's no strong data right now suggesting that the virus attacks the hair follicles, but
Mhm.
again, more along the stress that this pandemic has had.
How do you know when it's what are the symptoms that people are coming in with? Because obviously there's the natural hair shed that you have. Is it
Sure.
when it's coming out in clumps, or what are the symptoms that people come in with?
Yeah, they'll say, I'm brushing my hair and I'm just taking out, globs and globs of hair out of my brush, or there's a lot of hair on my pillow, or I'm clogging up the sink drain or the shower drains. My hair is just shedding all over the place. That's the general first complaint people are having.
Uh-huh. And when you say you're seeing more of that, what would you say is more? Like, I'm sure on a regular basis there's some of that, but what is?
Sure. I mean, we're seeing 2 to 3 times the amount of patients for hair loss, and I see a lot of hair loss, and in terms of volume of patients, because normally people shed about 100 hairs a day, and
Mhm.
now with telogen effluvium, you're at 300 plus hairs a day. So
Wow.
you're losing 3 times a normal amount of hair. I do skin cancer surgery, and I have more patients cry because of hair loss than they do when we're, diagnosing skin cancer. So, it is definitely, it's a very sensitive and personal, ordeal that people are going through that's very impactful.
So what can people do about it? Like you said, obviously they're coming in. This is another trauma for them. I'm sure they're concerned. They're worried. Is it gonna grow back? I guess that would be the first question. Is when you're seeing patients experience this, will it fix itself naturally, or do you need to do something medication
Mhm.
wise or treatment wise? Do you need to do something about it?
Yeah, sure, great question. So this telogen effluvium can last for up to 6 months. So it's a long time that you're going to experience that diffuse shedding. I think the first thing is to prepare patients to know, okay, this is common and it is going to stop, and your hairs will regrow. But it may not, you may still have this shedding for 6 months, and then it will slowly regrow. So it can
Mhm.
take almost up to a year to get your hairs back. But the
Wow.
first thing is to really educate the patient and reassure them that there is a light at the end of the tunnel. And things that I always advise patients, there are other underlying causes of hair loss. So you always want to make sure that you don't have any nutritional deficiencies or autoimmune diseases, or hormonal changes that can also contribute to hair loss.
Okay.
So, you should be seeing your primary care internist at least once a year to get routine blood work. You can come and see your dermatologist to look, make sure that your scalp is healthy, because there's certain things we look for in the office to see, okay, does this fit telogen effluvium, or is this a different type of hair loss?
Hmm. Are there things that people are doing that are making it worse too, that maybe they don't even, I mean, obviously the stress factor is there. You're probably already stressed, and then you're stressed that you're losing your hair. So it's probably kind of a cycle
Yes.
in that case.
Yeah, so definitely people are stressing more. And then, just having gentle hair habits. Some people like overly brush their hair thinking it'll get all the hairs that are shedding out, but overly brushing or overly styling your hair can also worsen the hair loss.
Okay.
But I really think just stressing about it more than you need to can also just make
Make
it
it
all
worse.
worse. So
Lifestyle stuff too, right? I was reading at least that like smoking and other things can
yes,
contribute to it. Is that true? Or are there other
that
like just
true.
bad habits?
Smoking is one of those things you really, it can definitely contribute to hair loss. We believe that. I think that's the act of smoking puts a stress on the body,
Uh-huh.
and those sort of chemicals that are getting into your body, I think does worsen the hair loss. So
Right.
just overall getting into better habits, I think having a well-balanced diet, having a lot of proteins, because proteins are the building block of our hair, nails and skin, and taking vitamins always helps because vitamin deficiencies are a good common cause of hair loss.
Are there specific vitamins that help? I know
Yeah.
people take like biotin and things like that, right? Or collagen. I don't know if that.
Biotin, there's less data supporting the use of biotin. Normal dose, standard doses are fine, but you don't actually need biotin supplements. There's little scientific data to support the use of biotin for hair regrowth. So we
Interesting.
recommend zinc, iron, folic acid, vitamin B12. Those are important. So I think just a well-rounded multivitamin is good. But
Okay.
obviously, if you have any sort of deficiency in any of those, you can take a more concentrated form of that. So
For those that are interested, do you provide any treatments, or are there any treatments that they can that are out there that would help at least manage it or minimize the amount of hair loss?
sure, there's some exciting treatments. We do a lot of platelet-rich plasma or PRP, and studies have supported that injections with PRP help to reduce the amount of hair shedding that occurs and also helps to speed up the hair regrowth process. You actually it's from your own blood. We draw blood and then we spin that blood to get purified platelet-rich plasma. So blood separates out into red blood cells and white blood cells, and we sort of purify that process to get just the platelet rich part of your blood, and then we inject that into the areas of hair loss.
How many treatments are necessary typically?
Generally we advise 3 treatments spaced 1 month apart, and
Okay.
then you can do a maintenance of like every 6 or 9 months
What's the
as
cost
needed.
typically associated?
It depends. It can vary anywhere, I think depending on where you go and what system they use, but it's generally, I'd say about $700 to $900 per treatment.
Okay. And so times three of that. Okay. But
Yes.
that you're saying you see dramatic results in terms of lack of hair loss, or is it actually kind of sparking the follicle to grow?
So we use it for different types of hair loss. In this case, with telogen effluvium, we'll see a reduction in how, because that telogen effluvium can last anywhere from 4 to 6 months.
Uh-huh.
So with the PRP, that can abbreviate, to be half that time even. So depending on when you come in during the cycle of hair loss, we can abbreviate that time up to half, even less.
Okay.
And then the hairs just regrow faster. So where it could take 1 year, it will regrow sooner than that.
Very interesting.
So for people who have a wedding coming up, or just
Yeah.
really just can't handle any more of that hair loss, it's a really good option for them to kind of just abbreviate the whole disease course.